Welcome back to Great Day St. Louis. Constant pain in your face and neck. Maybe you're even having trouble opening your mouth. Imagine that. Well, it started happening to our next guest about 5 years ago, but at the time, she wasn't exactly sure what was happening. Joining me now is Dr. Keller from Keller Professional Group and his patient Heather and her husband James. Good morning to all of you.
Good morning.
Thanks for being with us.
Definitely.
Heather, we're going to start with you. Take me back 5 years ago when you first started having this unbelievable pain.
Yeah, it was a lot of pain and was having trouble eating, and it was just neck pain, dizziness, pain in my ears, things I didn't realize were TMJ at the time. And we had done some research and decided that I needed to find a doctor that could help me with that.
And at some point you couldn't even open your mouth.
No,
really.
I was having issues getting a spoon of mashed potatoes in my mouth. It really had greatly affected my ability to function as a human being.
Yeah, and we talked about during this past commercial break, I mean, you don't realize how important it is eating for your health, but also for socialization. I
Definitely.
mean, you weren't going out and having fun with friends, even your husband.
Nope. No, we were home pretty much all the time, and it decided everything for me. My ability to function decided what we would do.
And James, talk about what that was like on your relationship. Got to be extremely tough from your angle, watching your wife go through all of this.
Yes, it's very tough to deal with, pain, because I don't feel the pain, but I live the pain even though I'm not experiencing it. And as Heather said, it did affect everything we did. What we did in the evenings, if we decided to go out with friends, what we had for dinner, what we did for entertainment. It was just all dictated strictly by the pain, and it was the center of our lives, and that's just a horrible, horrible place to be.
And Heather, what was the breaking point when you said, the treatment that I'm getting right now isn't working, I need to go to Dr. Keller and see what he can do for me?
Well, I had been doing an appliance therapy to try to readjust the position of my jaw for about 3 years, and the doctor that I was working with at the time had said, we're not going to be able to, appliance therapy isn't going to work for you, you need surgery. And I was really not interested in surgery, so he referred me to Dr. Keller. And Dr. Keller said, yeah, you really need surgery.
Yeah, Dr. Keller, why was it? I mean, there are people who go through the therapy, the appliances, they have medication, but there comes a point when it's so severe you need to have surgery.
It just depends upon how damaged the structures are. And sometimes they get so damaged you just can't work with them anymore.
And what was your reaction when you first saw Heather? You knew right away that that was what she needed?
We still try conservative therapy just to ensure that it won't work, but in cases where there's this much damage, you pretty well know that you're going to have to do the extensive treatments that were necessary.
And if we're able to put up some pictures of these x-rays, if you could walk us through what we're looking at here on the screen.
Well, what you're looking at are artificial joints on both the right and left side. The surgery actually has to totally reconstruct her bite. She has upper jaw surgery, lower jaw surgery, and then we take those puzzle pieces over the next 6-8 months and get her back functioning. And we just started this last week now with the orthodontics to make the teeth fit with where everything else is functioning properly.
And Heather mentioned 5 years ago when she first started having the pain, she didn't realize that it was TMJ. I mean, is this common in a lot of people, especially women?
Sure. A lot of people don't know. I mean, it can be headaches, neck aches, earaches, facial pain, noise. Sometimes you don't have noise when it gets dislocated. Like in Heather's case, it was not noisy. It's sort of the silent disease, and the problem is patients and families don't realize these people are hurting because you can't see it. If it was your knee and you had to walk with a limp, people would say, Claire, you poor dear, how can you do that?
Right.
But if you just have to hold your jaw still and not talk by not moving, people don't know that.
Yeah, and I got to ask before we go, what was your first meal when you were able to just chomp down on something?
Macaroni and cheese.
Macaroni and cheese tastes so much better than having to put it in a blender or something like that. Thank you to all of you for being with us today.
Thank you.
We appreciate it. If you are experiencing these problems, discuss them with your dentist or call Dr. Keller at this number on your screen, 314-638-4190. He'll help you find out why you have pain and what can be done, or you can always check out his website, drdwaynekeller.com, to learn more about TMJ.